Do you need a Medicare supplement plan? This is a question that we get asked all the time from people that are becoming eligible for Medicare for the first time and trying to figure this whole thing out. My name is Christian Brindle. I'm a licensed insurance agent. I own a company called Christian Brindle Insurance Services. We specialize in assisting Medicare beneficiaries navigate the waters of Medicare and find their best option based on their needs and preferences with their Medicare health plan. And Medicare supplements is a big part of what we do in assisting our clients fill up the holes with Medicare. So let's just dive into this, okay? The first thing that you need to understand when it comes to Medicare is when you first get onto Medicare, there is two parts of Medicare that come from the federal government. We like to refer to these in my office as original Medicare, okay? Now, original Medicare is actually Medicare Part A and Medicare Part B, and as mentioned, they're the only parts of Medicare that come from the government. Everything else you hear about that's Medicare related comes from a insurance company, a private insurance company, okay? And so when you have original Medicare and you first get onto it at 65, the best way to think about Medicare Part A and Part B without going too much into the weeds on this particular video on them is they work like two pieces of a puzzle that fit together to give you medical coverage. They both cover different areas and items of medical coverage, but when you put them together, they provide you with medical coverage. Now, that being said, on the medical coverage that they're providing to you, they pay about 80%, along with some deductibles as well that they both carry. There's a Part A and a Part B deductible, but after those are met, they pay about 80% of the items that they cover for the most part. And then they leave behind an unlimited 20% coinsurance or out-of-pocket for you to pay. Why this matters is because most health insurances in the United States do have what's known as a maximum out-of-pocket. Okay, they have a limit to how much you can potentially be responsible for, and Medicare does not when you have it on your own. And another reason why that this is important is because Medicare, while it does provide medical coverage, it only provides you with medical coverage, meaning it doesn't provide things like prescription drug coverage, dental coverage, vision coverage, hearing coverage, and a slew of other items. So it is highly encouraged that when you get onto Medicare to not just accept the bare bones of what Medicare coverage and original Medicare provides you only. It is a very good idea to have a Medicare supplement plan or a Medicare Advantage plan with your Medicare. These are plans that are picked up through a private insurance company, and they're kind of the two different paths that the majority of people on Medicare can travel, right? You can either go the Medicare supplement route or you can go the Medicare Advantage route. There are some exceptions, like if you are eligible for TRICARE for life or some kind of retirement plan or you're a veteran, this can kind of change up the situation. But for the majority of people, probably 90 to 95% of people that get onto Medicare, these are the two options that they're presented with. And people ask me all the time, which one is better? Well, this video isn't necessarily about that, but the truth of the matter is, and the short answer is, it depends on you. It has everything to do with your needs and your preferences, okay? Both sides have their pros and cons, and we have a slew of videos on this channel that actually explain and do a very thorough analysis and breakdown from an unbiased perspective on the two different options. But when people ask me, should I get a Medicare supplement plan? The short answer is, yes, you should, because having original Medicare by itself leaves you exposed in a huge way to potential out-of-pocket risks. Even if you're healthy, you might not always be, an accident might happen. It's very important to make sure that you're protected well and thoroughly. Now, it might not be a Medicare supplement plan that's best for you. Maybe it might be, but you might do better off with a Medicare Advantage plan. It just depends on who you are. So having either a Medicare Advantage plan or a Medicare supplement plan, depending on your needs, your situation, and your preferences, is highly recommended by my office and my company. By the way, if you need help navigating the waters of your Medicare, we are licensed in 45 states. We work with a slew of different insurance companies. Our services are absolutely zero cost to you. There's no obligation to work with us, even if you have a consultation. If you just wanted to kind of test the waters and kind of see what it's like to have a conversation with us, we'd be happy to help you. Our office number is 801-255-5340. Again, 801-255-5340. If you're watching on YouTube, you can also find that information down in the description of this video. Give us a call today. Speak with one of our licensed agents and one of our very skilled, helpful team members. We can give you a hand with this situation. Anyway, I hope we answered this question thoroughly for you. If we did, the best thing you can do in return for us is smash the like button on this video. It helps with the YouTube algorithm. It helps so many more people like you who really need to hear this information find it easier, so you can help somebody by hitting that like button. Comment your thoughts down below. What questions do you have? What videos would you like us to do in the future? Was there any questions on this particular video that maybe we didn't get a chance to answer? We'd love to have a dialogue with you. Make sure to subscribe. We put out weekly videos about Medicare specifically for you, and we'd love to have you come back and watch some more of our videos and learn some more. Thanks so much for watching all the way to the end. We appreciate it. And until next time, everybody, happy Medicaring.